your blood pressure is reported with two different numbers. For example, 120/80. These two numbers are actually the pressure measured at different points during a single heartbeat. The top number is referred to as the systolic pressure, which is the pressure in your arteries when your heart is actively contracting, or exerting force to push the blood to where it needs to go. The bottom number is the pressure in the arteries while your heart is refilling with blood in between beats. This is called the diastolic pressure. The American College of Cardiology, known as the ACC, and the American Heart Association, known as the AHA, are two of the leading organizations when it comes to matters involving the cardiovascular system. They have worked together to put out guidelines to be used amongst medical professionals when assessing heart and blood vessel health. They have concluded that a normal blood pressure is 120/80. People who spend extensive time with pressures greater than either of these values are at increased risk of adverse health outcomes. Now, just because your pressure readings may be higher than the recommended 120/80, that does not immediately mean that you have hypertension. The ACC, AHA guidelines actually state that the elevation must be consistently observed. Providers generally take this to mean that your blood pressure must be elevated for 2 or 3 consecutive, separate, visits. Once the diagnosis has been confirmed, it does come with an additional added wrinkle that indicates the severity of the disease. Let's take a closer look at each category. First, we have normal blood pressure, which is, as we stated earlier, 120/80. Next, we have the stage known as elevated blood pressure. This means that you have a systolic pressure of between 120 and 129 over a diastolic pressure that is less than or equal to 80. The next stage is stage 1 hypertension. This is diagnosed with a systolic pressure of 130 to 139 and, or a diastolic pressure 80 to 90. The final, and most severe, stage is stage 2 hypertension. This is diagnosed with a systolic pressure of greater than 140 and, or a diastolic pressure greater than 90. The stage that you fall into when you are diagnosed helps your provider to tailor your treatment to you. Now, you may be asking, why did I get hypertension? This is a great question. Watch the next video to learn more about the risk factors that may have caused this disease to progress. Thanks for watching. Join us in the next one.
Created using Powtoon.